Hi, I'm Kalvin Fu. I'm a fourth-year chief resident here at Temple. I went to Cooper Medical School right across the river in Camden, New Jersey, and I'm originally from North Jersey. So fourth year, the way our curriculum is set up is primarily elective time. There are administrative months that we do to kind of help build leadership skills and really help the transition into attendinghood. I'm currently in an outpatient psychiatry administrative role, so I've been doing a lot of work with supporting our third year's transition into the outpatient, some very QI, PI type of work in terms of revisiting charts and looking at some points that could be improved. That being said, we have lots of electives that are available for the fourth year. My peers are doing things as wide ranged as transplant psychiatry, psych oncology, working in the mental health court system. For my interests, I'm trying to get exposure to as many psych-adjacent fields as possible. So some work in HIV or maybe some work in pain or palliative. That's what I have lined up for this year. So moonlighting, as long as you're in academic good standing, can start third year. A lot of it reflects what we've done in previous years, and we do moonlighting internally. There's a good amount of opportunity to really supplement your paycheck and kind of get additional educational opportunities as well. Coming to residency, I knew I had an interest in addiction psychiatry. I didn't want to pigeonhole myself into anything and make sure I got a good general education. That being said, before anything else, I got placed into my addiction psychiatry residency fellowship of choice. I'll be staying in Philadelphia. And along the way, they've been incredibly supportive of the conferences that I've wanted to go to, even if it was up to 2 a year. Dr. Kovac, our program director, and other faculty, when they see things that might interest me, they'll send them along my way. So, for example, Dr. Morrison just last week sent me a webinar about opiate use disorder treatment in pregnant women that she saw in her email, automatically forwarded it to me. So faculty is incredibly supportive of people's individual interests while also making sure that we keep a good general broad view of the general psychiatry training we're supposed to be getting. For me, I kind of mentioned how it works for addictions. For my other friends that might be coworkers, they might be interested in things like forensics. They'll allow for moving rotations around to adjust that. And I know even this year we have somebody that's very research interested. We took half of his second year and really just made it research focused to kind of help him build on the timeline that'd be really conducive to him getting work done throughout residency.